Hi, it's Myth. This is my pre-surgery video regarding how I got to this point the day of surgery. I have had problems with my neck for a while now. I have done lots of home improvement projects and building things and picking up lots of heavy building material. So the first of the year, around February, my neck problems became real difficult to handle, unbearable. And initially, I went to an orthopedic surgeon who performed x-rays and an MRI. And he showed me where the degenerative disc disease or the arthritis was setting in my neck. So we began with the regimen of physical therapy. I had an exceptional physical therapist, and I went 2 times a week for about 2 months. And I was always very optimistic that the physical therapy would help. After about 2 months, the physical therapist, we'd gone through all the exercises, the traction, everything. The physical therapist told me that I probably needed to look at something else going on in my neck. I'm sure many of you are where I am because you think I'll get a little physical therapy, a few massages, and it'll all go away. I had massages until my neck was sore. Physical therapy exercises at the facility and at home. After physical therapy, I went back to the orthopedic doctor, and he referred me to, of course, next would be pain management. So I gathered all my MRIs and my x-rays and sent it to the pain management doctor, and they scheduled me May 13th for the first round of epidural steroid injections. That is the injection under anesthesia where you're asleep directly into the spine. After which I felt a little relief on my right side and no relief on my left side. So about 2 or 3 weeks later, I went back, and again, after being put to sleep, I had another injection into my epidural spine of steroids. After I realized that that was not going to be effective, I had to then make a decision as to whether to live with the pain, continue using all kind of painkillers that I really didn't like, or what to do next. I've been blessed to be able to talk with a lot of people who've undergone this surgery, as well as look at the YouTube videos here that helped me come to the decision. I was referred to Dr. Nimish Patel in Dallas, Texas by my niece who had the surgery about 2 months ago. She has done excellent, and after I saw how well she did, I made an appointment to see Dr. Patel. We stood together and looked at my MRIs to show the bulging disc between the C5, C6 vertebrae. And based on his confidence and advice, we scheduled the surgery for today, Monday, August 4th. And that's what leads me to this point. That's what begins this journey of surgery, healing, recovery, and getting on with my life. I know there are a lot of people who are very, very hesitant about this surgery. I mean, they cut your neck and they actually move your esophagus and your trachea over to get to the vertebrae, to remove the bulging disc, drill all the bone spurs all the way down to the base of your spine. Fill it in with whatever you're going to have, the cadaver bone or the bone from your hip. My doctor does take a little stem cell from the hip and inject it into the vertebrae spaces to aid with healing. So that's exciting, cutting edge surgery to me. So I'm expecting over the course of the year that the bones in my vertebrae will fuse totally. There are many, many people who've had this surgery, many people who've been successful with it, and go on down life's journey. I'm going to be very careful, very cautious, and do whatever it takes for the healing process to begin after I have the surgery today. So, with no further ado, I'm going to end this, and the next time that you'll see me will be after the anterior cervical discectomy with fusion. Thanks for staying tuned. I'll be back with you and progress the reports of this journey. Thanks.